the talk very soon. So just to give a little bit brief introduction of Dr. Namrata, she has been a dedicated general practitioner in Cambridgeshire since 2017. She completed her medical degree at Durham and Newcastle universities in 2010. And Dr. Namrata integrates her medical and naturopathic nutrition expertise with her meditation practices. So, this is a very holistic approach which she uses to support individuals in their health journey, bringing together conventional medicine and holistic well being. So, I'll hand you over to Dr. Namrata, and thank you.
Hello. Thank you for the introduction. I'll start by sharing the screen, and we'll start from here, right? So I presume you can see this okay. Yeah, Mala?
Yes, we're fine. Yes, you can see your screen.
So gastrointestinal symptoms, very, very common. Everyone on the planet will have some of these at least a few times in their life. Even babies have these, and healthy people have them. However, when it's persistent and it's severe, some people may find it very uncomfortable and very distressing, even though it may not be life-threatening, but it can take over your life. Now, what we'll do to start with, we'll just take a moment and we're going to practice an exercise. And this is an exercise that we use in digestive issues, to help with these symptoms. Some of you may have heard of this. It's called the vagus nerve exercise. So those who haven't heard of this, it's vagus nerve is the biggest nerve that supplies the digestive system. And if we can activate it, it will help with the symptoms. And this is why we call it the rest, digest, and repair. So this is the nerve for digestion. And what it is the opposite of what we call the stress response. So stress response, what we call the fight, flight, and freeze. Now, it doesn't necessarily mean that, we are mentally stressed. It could be what we call physiological, so it's body. So if someone is always in a rush, like life is become normal for a lot of people. You're rushing to get up, rushing to look after people, after yourself, going to work, like a hamster wheel, constant life, rushing to wait for retirement. And then when retirement comes, body's not as optimal. So then there's more visits to the doctors. So that's another stress. And then we kind of wonder, why is my digestive system all over the place? It's because of this. And many people are asked, how is your stress level to patients? And they say, oh, it's low or it's normal. And then when you go into the depth of what they actually do, their normal is actually this. Stress is their normal. So it's a very simple exercise. It's a breathing exercise. I've just put a picture here, but you can do it anywhere. You could be sitting, sleeping, watching TV, walking, breathing. And it's basically a belly breathing exercise. And if you want, you can put a hand on your chest and a hand on your tummy, just to kind of see that when you breathe in, you're pushing your belly out. And when you breathe out, you're pushing your belly in. It's not forceful. It's very normal and gentle breathing. So basically, you breathe into your tummy or into your belly and breathe in for 4 seconds. You hold for 4 seconds. You breathe out 4 seconds. Hold for 4 seconds. And breathe into your belly. So you keep doing that in a very natural way without forcing. So keep doing it, just naturally breathing through your belly and breathing out from your belly. Your chest normally doesn't move, but if the chest moves, that's also okay. It's called box breathing, controlled breathing, or diaphragmatic breathing, because we're engaging our diaphragm in our belly. And then while you keep doing that, what we do know is usually when we're sleeping or when we're meditating, or if you have a natural kind of meditative life, this is our natural. We normally breathe through our belly anyway, because vagus nerve is fully activated. And while we are practicing this, of course, we are more aware of our breathing. There's more awareness in general in terms of present. We're more present rather than thinking of other things. But a step further from here is while you keep breathing, you can put your hand in your chest, one in your belly, breathe in and out. While you keep breathing, the next step is, you're more aware of yourself, of your breath. Next step is you watch yourself breathing. So you may be sitting on a chair, you may be lying down or multitasking, driving, whatever you're doing, just watch yourself doing that. And basically, you're watching your own body. And while doing this, you bring in the feeling of amazement while watching yourself. And you think, wow, such a wonderful person, such a wonderful body, a wonderful, sophisticated body, which has been through all of these highs and lows, and it's still as strong, in fact, stronger than ever. And while seeing yourself, your own body, breathing in and out, you also see the wonderful life story that this person has been through. You see your own timeline and such a unique personality, and you tell the person you're seeing, i.e., yourself, well done, you're doing very well. So, what we call this activity is a shift in perspective of what we were seeing. And this is another name in psychology is third person perspective or observer viewpoint. So you're basically objectively looking at yourself, your life, your symptoms, your feelings. And what it does, it helps with emotional regulation, helps, with anxiety, and it makes you kind of more objective and rational in the decision that you make. So all of this that we've practiced, the belly breathing, shift in perspective, and some of you would know different forms of meditation, it activates the vagus nerve, which is crucial in digestive symptoms. And later on in the talk, we will explain why. Because they're so simple, these exercises, and a huge effect on how we feel in the symptoms. Right, so let's look at a typical presentation when we have symptoms. So usually if symptoms are persistent, they are severe, or we have concerns, it's important to see the doctor for diagnosis. And what they will do, they will check for red flags, with the history. Things like, are you losing weight? Is the food stuck? Nausea, vomiting, blood in vomit or stool. They will examine. Depending on that, they may or may not do investigations. And usually you will get a diagnosis, either this is gastroesophageal reflux disease, which is acid reflux. It might be a bout of symptoms after you've had a gastroenteritis, so a stomach bug. Some people are left with lactose intolerance or gluten intolerance, or temporary symptoms, bloating, reflux, because the tummy is quite inflamed. And the other one common diagnosis, IBS. So these are especially if all your investigations are normal and there's nothing that can be found. So irritable bowel syndrome, which means your bowels are just very sensitive. There's nothing else that's happening. Could be gastritis, inflammation of your stomach. And the reason I've mentioned silent reflux, I'm going to speak a bit louder. So the reason I've mentioned silent reflux is because this is something people don't even, they're not even aware of, right? So they get a lot of what we call ENT symptoms, ear, nose, throat, and dry cough, throat clearing, dry mouth, voice changes. Sometimes the ears feel full, and then we go down the route of having cough medicine, lozenges. But even though we don't feel anything in terms of acid, in terms of indigestion, the damage is being done, because it means acid is coming from our stomach up to our gullet or esophagus, but we don't feel it. And our esophagus, gullet, is the same environment as our mouth. Stomach is very acidic. So if you are to put acid in your tongue, you know what will happen. It will burn, right? And this is what's happening with acid reflux. It's kind of little amounts of burning to the gullet. It's coming up, but we don't feel it. With time, it can cause inflammation, it can cause ulcers, it can cause Barrett's esophagus, all sorts. So if these symptoms of dry cough, ENT symptoms are not clearing, it's worth thinking, is it silent reflux? You can try some over-the-counter remedies to test, does it get better? But you may need to see the doctor. Investigation would include some blood tests, stool sample, and sometimes more, like camera test. They might do x-rays, different type of testing for acid. And then some other diagnosis that could cause these is just to let people aware of what it could be. So if we have gallstones, bile acid reflux, it's basically bile from the gallbladder refluxing up. Usually people have a metallic taste in the mouth. When they eat, they feel better. When they have fats, fatty meal, they feel worse. And then peptic ulcer is stomach ulcer, severe pain. You feel cramps. Sometimes there's blood in the reflux that you feel. people may be aware of celiac or gluten. Celiac can be checked in the blood test. And then the stool sample, GP would check for a bacteria called Helicobacter. There might be advanced tests to check for blood in the stool, inflammation in the stool, for inflammatory bowel disease, like Crohn's or ulcerative colitis. And then more specialist tests to check the surface of the esophageal or the stomach, to check for ulcers, inflammation, etc. It's very important to know about non-digestive causes. We can't put everything to digestion. So if people have got risk factors and they keep getting indigestion or heartburn, especially after meal, that doesn't get better with antacid, or if it's persistent and you have a family history of heart problems, you feel breathless, heart is beating fast, cholesterol is high, there's high blood pressure, be aware that sometimes what we call angina. Angina is a lack of blood supply to the heart that causes symptoms. And silent heart attack, you don't feel chest pain, you just feel unwell, nausea, heartburn, cold sweats. Like some people say, a feeling of impending doom, and that's diagnosed with ECG or blood test. So you may need to ring 999, Other things would be your lungs, if there is any problem with the lungs or the ribs, that can cause similar symptoms. Then if there is, say, enlargement of the liver, spleen, pancreas, kidneys, so we're talking about different growths, that could be pushing on your belly. And when it pushes on your belly, then that can cause bloating, it can cause reflux and all sorts, so be aware, you need to see GP. Thyroid disorders through blood test, that causes all sort of digestive issues. And yes, for women, be aware, if you've got fibroids, there's ovarian problem, womb problem, that can cause bloating and similar symptoms. So may need to have an ultrasound scan. So bottom line is if you have symptoms, depending on your risk factors, it's always good to consult the doctor. Don't just self-treat and wait for it to get better. And then, so what we're going to do, well, actually, before that, so when you see your doctor and if all the investigations are normal, usually, you may be started on some medications like lansoprazole or omeprazole, Rennies, Gaviscon, all of that. The question is, do you need it? One. Second is it going to be long term? That's, it's important because short term is okay, but when we're thinking long term, it will have side effects. So the question is why you're getting these symptoms and what can you do to make it better? Medication, temporary, or as and when you need them, unless you are on other medications like aspirin, and then you use these digestive meds to protect your stomach, which is a different matter. Now, the doctor might advise things like, avoid triggering food, like spicy food, oily, processed meal. They will say don't eat too late at night. They might tell you to lose weight if that's an issue. They might say, might need to incline the bed to prevent the reflux from going up. And say, you do all of that, but then with time, you feel it's still persistent And many people, I find, they end up seeing the specialist. They have all the investigation, everything is normal, but the symptoms don't change. And the feeling is, we have to look at a very individual approach. We cannot just give the blanket advice, or do 1, 2, 3, 4, it has to be very individual. And it very much depends on the lifestyle of the person. So this is what we're going to explore, because when we understand things better, how the digestive system works, we will be able to identify where the problem is. So this is what we're going to look at. Now, digestive system, of course, from the mouth all the way to the bottom, and anywhere there could be a problem. So starting from the top, in terms of symptoms, what am I eating that's causing the symptoms? It's good to know that in the mouth, we have got digestive enzymes to break down carbohydrate, what we call amylase. So this enzyme, it's in the mouth and it's in the intestine. It's not in your stomach. So if you don't eat and chew properly, and if it's a carbohydrate diet, and if you've not broken it down properly, it goes into the stomach and it will just sit there, and it can cause problem because it's just too big, and it will have to wait until it goes into the small intestine to then be digested. So it's important to chew properly. That's the second. Am I chewing enough in the mouth itself? Am I eating too much or too long hours of fasting? So when we fast for too long and stomach has acid and it's not getting food, it will give you reflux or bloating. If we overeat, then that puts pressure on the stomach, pressure on the diaphragm, and weight can also put pressure. We will explore each of them as we go. Then between the stomach and the esophagus, there's a sphincter, a valve. If that valve is lax, as in it doesn't shut completely, for whatever reason, that can get reflux. So that valve, it has to open, when we eat, there's contraction, it opens. But if it's relaxed all the time, then it's kind of, you get reflux in there. Certain food like, excess caffeine, alcohol, peppermint tea, they can cause that, or they can make symptoms worse in people who already have a relaxed sphincter. Some people have hiatus hernia. So what it means is the top of the stomach, it goes a little bit up on the diaphragm. Some people it's from birth, and some people it just happens. There's nothing right or wrong. It can just happen. So we may need to adjust how we eat to prevent this reflux. And stomach acid, we're going to discuss that further. If our stomach acid is too low, so we need acid to digest our protein, our fats, to absorb our iron, calcium, all of that. If, say, stomach acid is low, the problem may not be the food. You may be having proteins and it's okay, but if there's not enough stomach acid, you may not be digesting the proteins. So then we think, oh, is the problem the food? But it may not be. It could just be the stomach. And then, yes, so digestive enzymes. So do I have enough enzymes? So these are the amylase, protease, lactase, lipase, to digest fats, carbs, and protein. And is there enough of that? How is my gut motility? If the bowels are contracting too slow, then there will be constipation. If, there'll be bloating. If it's too fast, that itself can cause cramps, bloating, and all of that. And finally, what we call the gut microbiome, the gut bacteria, they are very much involved in our digestion and what we call the gut-brain axis. So the initial vagus nerve activity that we did, it's to do with this. So this is the nerve that connects from our brain all the way to all our digestive system. And vagus nerve, rest and digest nerve, if that's not working, and it's the stress nerve that's on all the time, chronic stress, fight, flight, survival mode, then that will cause problem. And it's very closely connected to the gut bacteria. And the way we see it is it's two-way system. So say if you're happy, your gut microbiome, your gut bacteria are happy, and you will be fine, your digestive health. If you're not happy, your microbiome won't be happy. But on the other side, I think for most people, is if your gut bacteria is not happy because of the food that we eat, because of the state of our gut health, then the gut microbiome, they are actually live bacteria. They are living organisms in your bowel. So they are not happy. Then they send signals to your brain that I'm not happy. So the brain, the serotonin, which is the good feeling in your brain, the dopamine, they will be reduced. Then it's basically the other way around. Then you wonder why you're feeling low, sad, getting more digestive symptoms. So it's a two-way process. Right. Now, looking closely at each of them. So what am I eating? Many triggers we will identify ourselves. And, biggest one would be the dairy, beans, pulses. So for beans and pulses, it's sometimes the actual fiber in them. It's sometimes something called anti-nutrient. So it affects our digestive system for some people because they cannot produce enough enzymes to digest them. They're too hard on their stomach. And in some people, it's a problem with the stomach acid. Now, with gluten, the reason I've highlighted this is people who do not have celiac disease may still be gluten intolerant. And you will also find there's so much research now on how there's a protein in gluten, gliadin. It actually causes inflammation in the bowel for everyone, but not everyone has symptoms. Because what it does, it releases a toxin in the bowel, solidin toxin, and that one, it causes what we call leaky gut. So leaky gut basically means inflammation. Instead of your gut boundary blocking toxins coming in, when they become leaky, they will leak the toxins in, and that can cause problem. And of course, all the other things, caffeine, alcohol, processed food. So all the ready-made food, ready-made things, there are so many preservatives, coloring, even the bread. If you look at the bread that you buy in the supermarket, if you make bread at home, you maybe need 4 ingredients, water, flour, yeast, salt. Look at the bread that you buy from supermarket. It has 20 ingredients, and that's all preservatives. So in bread, it's not only gluten, it could be the preservatives, all the E numbers. Then when we think about gluten, pulses and beans, I wanted to add that for some people, it's maybe not a digestive issue so much, and you may want to try different ways. So how do you reduce those anti-nutrient that's causing problem in the beans? So you can soak them overnight. You soak them with these things called fennel seed, aniseed. We'll talk about this a bit. And you can sprout them. So sprouting, it reduces the anti-nutrient, what we call phytate, but it increases enzymes. It increases enzymes 100 to 300 times, making it more nutritious, and it increases the vitamins, minerals by that much. So that can reduce the bloating because more enzymes to digest. You can mash them. So whatever way you're cooking, you can mash all of them to make like a hummus type of thing, or you can mash half and different ways. So these fennel seed, aniseed, we call them carminative herbs, which is gas absorbing. After that, you can even drink homemade carminative tea, and we'll give you some examples. Now, some people, if you eat fruits after your main meal, fruits are easily digestible. So if you eat it first, it will digest in your stomach quickly. But if you've had your main meals and immediately you have fruit, your body, your stomach is digesting that protein, which may take 2 hours to digest. That fruit may be sitting there waiting for your main meal to be digested first. And then the fruit will ferment, they will release sugar, they will cause bloating. So, in what pattern you're eating is very important to know. Eat the easily digestible one first and the one that's longer to digest last. And some people who have problems, if there's too much fiber, and that can cause bloating. But some people take too much fiber, but they don't have enough water. So that can then cause constipation. So make sure that you have enough water if you have fiber. And some examples of this carminative tea, so gas absorbing, will be these. Peppermint is good for irritable bowel. But if someone has a lax sphincter, so getting reflux all the time, peppermint tea may cause more reflux. So just observe and see if it's helping or causing problem. Because I've had patients, they have habit of having peppermint tea at night because of irritable bowel or just habit, but they don't realize that their reflux is connected to this. And then how am I eating? Again, this is a very, very simple way to change, because most of us are eating quickly, not chewing enough. The food remains undigested in our stomach. Just what we said in our previous slide, digestion starts in the mouth. So eat slowly, chew well, try not to talk too much during eating, to do with our vagus nerve, because otherwise, we'll be rushing. Some people who drink too much water during eating, too much water while eating, it can cause more bloating. And what we say, dilutes your enzymes. So enzymes are not optimally digesting. And if we are in chronic stress, as in life itself is a rush, then it's the stress chemical that's activated, not your vagus nerve. So the exercise that we did on vagus nerve activation, belly breathing, very simple. You can do that before every meal. And eventually it can become your normal if we're used to practicing this controlled breathing. So yes, eat mindfully, vagus nerve activation. We normally say chew 20 times. It's just a way to try and be mindful, to be in the present and to be aware. And it's the beginning. eventually you'll be used to it. You will chew well. Then we look at, how much I'm eating. Am I overeating, snacking? People who are doing long hours of fasting, it's important to observe the symptoms because we don't connect the dots. We think it's something else. But if there's long hours of inappropriate fasting, what it means is your stomach is still producing acid, but there's no food to digest. So it's just sitting there, and that will give you symptoms. Usually, for everyone, overnight fasting, this is normal, You had your dinner at 7 or 8, then you have your breakfast at 7 or 8. So 12 hours, it gives enough time to clear your digestive system. And then if you want to do more fasting, you have to slowly increase it, 13 hours, 14, but really observe if any side effects, right? And it's also recommended, 3 to 4 hours between your meals to give your digestive system a rest and time to clear up any toxins. If it doesn't have time to clear these toxins because we're constantly eating or snacking, then these toxins will cause problem, digestive problem. And last meal, 3 to 4 hours before bed. Again, with the fasting, if you wish to have longer fasting, 16 hours, intermittent, 2 days, and you're having symptoms, you need to seek professional or nutritionist advice just to see what's there that's not kind of connecting. Now, if people are used to fasting and now you're having symptoms, you want to maybe break the fast, it doesn't mean you have to have big meals 3 times a day. Even something small, like a small smoothie, small liquidy drink, like chia seed pudding, just a little bit of something to soothe the stomach, and your stomach has some type of food to digest, may help. We'll talk about this later. Overeating. I find people, they fast, and then in that small window, they have a large meal because they think this is my one meal. Let me make the most of it. Your body may not have the capacity to digest all of it. It's excess food, So anything that's not digested, it just sits there. It rots in your stomach, it rots in your intestine, and it releases gas. So that's causing the bloating. So best to have small meals twice a day, 3 times, even if it's a small window, but small digestible meal for your body. Some people, when we look at their food diary, you see they think they're eating small amounts and often, but actually we say they're eating like a bird, just snacking in the morning, snacking 2 hours, and they're very happy because they're losing weight because that's their aim, but so much symptoms with bloating, with acid reflux, tiredness, and because the body is releasing toxins, your body cannot be 24-hour working, digesting all the time. It needs what we call housekeeping. Housekeeping means it has to have time to get rid of the toxins. And when we do that, if there's not enough vitamins, enough mineral or protein in the diet, then body is not being given the raw material to repair. So whether there's inflammation, whether there is, reflux, we need to have these raw material to be able to repair. So making sure we eat, even if it's a small meal, it has to be nutritious. So it has to have protein, enough healthy fats, enough maybe a little bit of carbs, vitamin, minerals. Yeah. Now, stomach acid, this is something they don't discuss in the Western medical field because the quick thing is you have problem, just give you a tablet and off you go. But it's important to know about stomach acid because there's a reason why our stomach is producing some acid. To produce this acid, we need enough zinc and B vitamins. So if we don't have enough of that, our body, our stomach, may not have enough raw material to produce this acid. And why is it important? While you're eating, you may be digesting toxins. So the acid will try and kind of kill those toxins. If there's acid, it will release those enzymes to digest your food. If there's not enough acid, then there's more risk of bacteria in your stomach. These bacteria may then go into your intestines as well. And, we've heard of these bacteria called Helicobacter pylori. What we do is when we find them in the stool, we give antibiotics to kill them. And then if in a few years you are to test again, it will still be there. And you think, because we have to question why. If there was enough acid in the first place, there wouldn't be the H. pylori, the bacteria. But now that it's populated, because it's a very nice environment, they themselves can increase the acid. So we get what we call acid reflux. And if there's not enough acid, proteins, fats, don't get digested, they rot in the stomach, cause bloating, gas. You may not absorb things like iron, calcium, B12. They need some acid to be digested. If you are on lansoprazole or omeprazole, they can completely block your acid because that's what it does. Their role is to block acid, as opposed to other things like Rennies and Gaviscon. They neutralize it. They don't block the production, right? Now, those who are on aspirin for their heart, or they're on ibuprofen, naproxen for other reasons, you then need to be on PPI, lansoprazole or omeprazole, to protect your stomach, because these aspirin, they can cause ulcers in the future. But even though you are on the lansoprazole, it doesn't mean you're doomed. We have many ways to adjust, maybe give you digestive enzymes, maybe have more kind of supplements to replace whatever is lost. Now, things that can reduce stomach acid, the biggest thing is chronic stress. Like we said, if you don't have enough vitamins, refined sugar. Our diet is very much high refined sugar. And some medication. So if you are taking ibuprofen and you don't need it, the question is, should you be taking them? So we need to be careful. Infections, and as we age, our stomach acid gets lower as well. Now, when we talk of high stomach acid, that's quite straightforward because you will feel it, the symptoms, heartburn. We've talked about silent reflux. This is to address the triggers, avoiding certain food, avoiding certain medication. With these lansoprazole, omeprazole, what happens is when you stop them, there's a rebound. Suddenly, you've been suppressing this acid for so long, there could be a huge rebound. So it doesn't mean, what we do is we slowly come off them if we have to. We talked about these long hours of fasting, late eating, snacking, the bacteria, smoking, all of this we've talked about. And reducing weight, may need to recline the bed. Right. So what are the ways we can increase our stomach acid if it's low? Normally, you won't know that it's low. You will have symptoms and all your tests are normal. So to start with, common things, common sense thing would say is eat slowly, chew well. And when we're activating this vagus nerve, it triggers, while we're chewing in our mouth, when we're breathing with our belly, it triggers these stomach acid and enzymes in the stomach to activate. So it's ready for the food when it gets into the stomach. Some people have what we call bitter salad. So anything that's bitter, when you eat it before your meals, it does the same thing. It activates the acid and the enzymes in your stomach. And some people would have a normal salad and then put some apple cider vinegar, or you can put some lemon juice, because anything that's bitter and makes you kind of wince a bit, that's activating acid. Some people choose to have this apple cider vinegar, like in water. So, especially for bloating, if you are using it, you use organic and you put a small amount to start with, very small amount, 1 teaspoon in 200 or 300 mils of water, maybe 15-20 minutes before you eat, and you use a straw because vinegar is very, very strong. It can damage your teeth. So use a straw. If you're getting acid reflux, or if you're known to have ulcer, you cannot have it plain, right? So you might need to avoid or use bitter salad. If you've seen a nutritionist or you've sought advice, they may advise these apple cider vinegar capsule, or bitter kind of capsule, but you have to seek advice. And it's not for long-term use. You're using it, you're assessing your symptoms, or unless you are under a practitioner, because long-term use, I'm talking about years of using, may cause problem. So we have to know, whether we need it few months, stop, intermittent. And then we talked about digestive enzymes. So like we said, sometimes the problem may not be the protein, the beans and pulses. Problem is you don't have enough digestive enzymes in your stomach because there may not be enough stomach acid. So the natural ones would be things like pineapple, papaya, mango, kiwi, there are loads, right? But some people who have acid reflux, when they eat these food, it can make it worse. So then maybe temporarily, they may need it in a supplement form. So they are supplement like Acid Calm, good quality supplement that can provide these digestive enzymes. If you have peptics or stomach ulcers or kind of severe pain in your stomach, you cannot be careful about digestive enzymes. It will make it worse. It will make your ulcer worse. And we said about how refined sugars and processed food can reduce stomach acid. So that, and then fresh fruit, vegetable. So 25-30 variety of colored vegetable, especially green vegetable. They are more what we call alkaline. Alkaline means opposite of acid. So if you're having more vegetable, even vegetable smoothies, soups, that can help with the symptoms. Unless, some people have irritable bowel syndrome, and there may be some veg that doesn't agree. So you need to see what agrees with you. Now, if there is acid reflux, other remedies would be, soothing and digestible food. So things like chia seed pudding. So you mix 2-3 tablespoons of chia seeds in water overnight. Then you can, you can Google it online. You can add berries and honey and make it tasty. So that can be a breakfast. You can have aloe vera without the sugar. jelly type porridge consistency. Then demulcent herbs, they're actually soothing, what we call mucilaginous. They are anti-acid. Now, we need to be careful with herbs. So use it if you've done your research and you know what you're doing, because things like marshmallow root tea, slippery elm, aloe vera, meadowsweet, licorice, you can get them, from Holland and Barrett's or any health shop. Talk to them, because some of them, if you have maybe one or two teas, that's okay. If you're having a lot of tea in a day, that counts as medicine because the dose is high. And if the dose is high, means it may cause side effects depending on your condition. So licorice can cause blood pressure. Meadowsweet is actually natural aspirin, right? So because it's aspirin, it may cause problem. So yeah, if you have no medical problem whatsoever, then fine, fair enough. If you're on other medication, you have to take these 2 to 3 hours apart because it puts a coating on your stomach, so you won't be absorbing other medication. Now, things to be aware of for natural ways for acid reflux. Raw cabbage juice, you can make it at home. There's a technique to do that, so you research it online. It has got what we call vitamin U, and what it does, it neutralizes the acid, and it's one of the herbal kind of natural remedies for stomach ulcers. We know that cabbage, especially red cabbage and some other green veg, they have this protein called L-glutamine. So glutamine is one of the things that actually it helps with leaky gut. It soothes your stomach lining, and it's really good for acid reflux, for repairing your stomach lining. And some people may be aware they do sell them as supplement, L-glutamine powder. Any supplement you use, it's not forever, it's maybe 1 or 2 months. Like we said, speak to a practitioner, make sure it's good for you, no other contraindication, and then you use for 2 to 3 months, assess, and go like that. Then other type of green veg smoothies, what we call alkaline type food. They are anti-inflammatory, so they are anti-acid. Alginate, they are actually like when you have them, they put a foam, they become a foam in your stomach, and that foam, it puts a plug between your stomach and your esophagus, so it will prevent the acid going up. It doesn't block the acid. It's made from seaweed, so it's natural, and they sell them. This is something even doctors advise. So if you're buying Gaviscon or Peptac, there are many different types. Make sure it says alginate, and it will have maybe some calcium and all. It needs those calcium, sodium to be able to make that foam in your stomach. So that's another way to help. Now, looking at gut motility. So, all these symptoms, bloating, reflux, indigestion, everything is going up against gravity. We want to push things down, So these are all how do we push things down. So for constipation, it shouldn't be taken lightly because every day that you do not open your bowels, you're recycling that toxins. So it's no small thing to be going every 2 days, once a week. It means all the toxins are going back into your blood, back to your liver, and it's accumulating. It will cause problem. So we need to, ensure that we open every day. And it might be a slow process. You can't go from once a week to every day, but just be aware. So increase fiber and water. Fiber, that's what we call the prebiotic. They will feed your gut microbiome. Probiotic would be things like, Greek yogurt, kefir. There is tempeh, tofu, fermented tofu, sauerkraut, fermented cabbage, those kind of things. they feed, they actually extra live bacteria, so they help with that. And I've put some examples of seeds, soft food, prokinetic, anything that will make your bowel move faster, then it will help move your gut, right? So that's ginger tea, artichoke fiber, peppermint. I've put some examples of natural laxatives and then supplements. So you might need to get some natural fiber like ispahula. If you have stress and constipation, maybe a magnesium citrate. So the citrate is the one for the constipation. Magnesium would be stress. But again, make sure that you don't have any other medical problems before you take supplements. Movement. So sometimes, walking, there's some special yoga postures. So if you Google, yoga posture for constipation, very simple one where it uses your breath and kind of twisting your bowels a bit. Diarrhea. For diarrhea, it's the underlying cause that we treat. So it's common in people with irritable bowel. Sometimes we might need to replace the digestive enzymes. Dysbiosis, it's like leaky gut inflammation. So might need to give probiotic, soothe the gut lining, electrolytes. Sometimes there could be diarrhea because of constipation. So if there's a lot of constipation, any food that you eat may not have space to become solid. So they stay liquid and then they bypass that constipation. They come as diarrhea. So be aware. And then stress can cause. Now, the most important thing, what we address right at the beginning, exercising with the vagus nerve. Now, with we talked about gut-brain connection, but there's this mind-body connection. We've already talked about stress, not just mental, but also physiological, a lot of pressure on the body. For IBS, there is therapy like cognitive behavioral therapy. And many people think, I have bowel problems, I'm not stressed. Why should I go for mental health therapy? It's to do with the vagus nerve. But it's important to know the reason they may not work is if we're not focusing on the root of the problem. So just relaxing and meditating may not kind of sort the problem. It's, we need to make sure we're not avoiding the problem. So when we talk about physiological stress, so not mental health, but it's kind of, am I burning the candle at both ends? Am I doing too much? So some people are super focused on diet, you're overdoing things, over kind of, everything overdoing, exercising too much healthy eating, lack of sleep, like basically no time to breathe. We find if people have, inability to say no, you don't self-care. We have mothers, carers, people who are responsible for others. they might be kind of, facing that work till you drop, right? And what we call the suppression sign. So if we're suppressing, then it will result in eruption. So acid reflux is like an eruption, passing wind, or kind of burping, all of that. The perfectionist trait, wanting to get everything right. Too much pressure on body, we talked about, trapped in many roles, mother, teacher, doctors, whatever work you're doing, plus different roles. So it's it's too much. And then we're overfilling our life with things to do instead of focusing on just be and breathe, And for that, usually CBT may work, but not completely. We need what we call a change of mindset. And this is the second exercise we did. It's part of it, when we were watching ourselves from a third person perspective. And like we say, not just relaxation. Now, when conditions are more chronic, like acid reflux, bloating, not getting better, then we think there might be, many reasons, not just food, but it could be maybe genes, parents had it, you have it. But parents having it doesn't mean, or you having the gene doesn't mean it will activate. Sometimes other things, it could be environment, it could be food, stress that activated. Now, this book is interesting by Dr. Gabor Mate, When the Body Says No, The Cost of Hidden Stress. You don't have to buy the book. It's on YouTube. You can listen to his talk, right? But he found 4 areas of where these are the people more likely to have these conditions. It's not just digestion, it's many other autoimmune conditions. So things that's persistent, like IBS, and it's not getting better. So many people would find themselves, you can identify yourself. So work till you drop. Like the doctor who thinks he's going to be a forever doctor and then retires, and you've lost the identity. You don't know who you are anymore because you have no purpose. So you forgot what is my real self? Who were you before you were born, kind of thing. When we feel responsible for others, like we say, the carers, the mothers, females are very good. Even people, I've had priests in practice where they suffered from IBS, and they wouldn't, of course, they don't believe in psychological treatment because they felt they were doing okay. And then, funnily enough, when they were diagnosed, I've had one priest recently, he had 30 years really battling because he couldn't do his work as a priest because he has to rush to the bathroom. Sometimes the cramps would be bad. And he had all the investigation. And then after 30 years, he was diagnosed with lung cancer. Lung cancer, not because he was smoking, it's just a different type of cancer and anybody can get. And funnily enough, because maybe that shifted his perspective of how he viewed life, of what he's actually doing, his IBS symptoms 100% stopped. He didn't have symptoms he's been battling for 30 years, just stopped. And you think, wow, what's happened in his psyche that he's thinking a different way, and that sorted the problem, the shift in perspective. And then, the next one, when we ignore our own emotional need and we care for others. It's good to care for others, but what happens, we say, in the name of caring, in the name of mothering, in the name of service, you don't look after yourself because you think you're doing for greater good. But if you are to break your bone or become unwell, you're going to be lying in bed, and that's a waste. So if basically it's think long term, how can I serve long term? To serve long term, you have to look after yourself. If you're not there, the service won't happen. Yeah. And also it's about trusting that others will manage, others will be okay. We can't save the world, can't save everyone, and we have to trust that they will be okay. And then suppression. So like we say, there is no such thing like suppression. If you suppress, they will definitely come out another way. And some people say, I don't get angry, I just grow a disease, so it's important to recognize these hidden type of things. Now, of course, we don't have time to talk about shift mindset and perspective, but I will recommend every few months, Cambridge Inner Space runs this retreat, and they talk about, in depth about shifting mindset, finding the authentic self in terms of identification, seeing the bigger perspective. It's free, so you can enroll on that. And there's some recording from previous as well. And yes, if you're interested in various talks we've done, so what will be connected to this talk will be the nutrition and emotion. There's one on weight management, menopause, metabolic health. So have a look. Vagus nerve and physical health for those who are vegan, vegetarian, mainly for people who are already following a spiritual lifestyle or have done the Raja Yoga course. You can contact Cambridge Inner Space. So that's it for now. Yes, that's the last slide. And I know a few direct questions I got. The apple cider vinegar, the reason we say not forever is you have to know why you're doing it, right? If you're doing it to kind of sort of, a few symptoms, so say if it's good for blood sugar balance as well. And if you're doing it and you've addressed various symptoms and things are better, it's good to stop for a while. So say you might use it for 6 months. After that, you may use it twice a week, 3 times a week. After that, reduce. And then when needed, you can increase. But the key is just talk to a therapist who knows what you're doing. And then, yes, we did talk about the hiatus hernia. So if people have a hiatus hernia, so this is a physiological problem. This is structural. So your stomach is pushing up. There's nothing you can do physically to push it down. So what you do is you have to address your food to make sure that everything is going down and it's not going up, like acid is not coming up. So small amount of digestible food. We talked about the soothing food like aloe vera, like the chia seed pudding. We talked about the alginate foam that you put in. We talked, everything that we talked about, chewing well, eating mindfully, all of that would help with symptoms. Yeah, so I'm just going to stop sharing and welcome any more questions.
I think there are a couple more questions. The tea coffee one, did you see that one? So if I drink tea coffee in between meals with milk, does that affect fasting 3/4 of an hour between the meals?
Fasting means 0 calories, only water or herbal tea is allowed. Not anything you add milk, that's calorie. So that's not fasting. Yeah, so herbal tea and water only is allowed in your fasting period. As soon as you've put milk, it's not fasting anymore.
And then one more question there. What are your thoughts about taking supplements?
So if symptoms are bad, supplements will work quicker. You can use food. Food might take 1 or 2 years to work. So supplements will work quicker, will address the problem quicker, but it has to be good quality supplement, not just willy-nilly any cheap ones. And what we say is capsules are better, powder, spray, and not tablet. Tablet, they have more chemicals to bind the supplement. So if you're buying from a health shop, a good health shop, online one, they will have nutritionist. You can speak to a nutritionist. You can. So if you Google some kind of good brands and you find, I'm not allowed to tell you brands because I'm not selling for them, but say you find a brand, ring them. If they will have a nutritionist if they're a good one, and they will tell you what are the good ones. Yeah.
And I think Lorna is asking if you could put the last slide back up.
The one with this is on Cambridge inner space well-being. Is that what she wants, or?
I think so, yes.
Yeah, I can't see the chat anymore, but that's fine. Or maybe, is that okay, Lorna? So basically, it will be on Cambridge Inner Space anyway, recorded, and all of this is on there, on the YouTube channel. There's a folder called Wellbeing folder. Okay.
Any other questions? Oh, Heather's shared that. Thank you so much. That was a wonderful talk. Lots and lots to think about. Very detailed. So any further questions anyone has for Dr. Namrata? Otherwise, thank you so much. And as Dr. Namrata was saying, all this will be found on the Cambridge site. If there's any questions, please reach out. Thank you. Thank you all. Got all the hearts coming up there. So we'll just stay on for a couple of minutes in case you have any other questions. So far, nothing. Okay. Thank you all. Thank you.